Next presentation is by Dr. Subhangi Sahu to report a rare case of orbital apex syndrome secondary to nasopharyngeal carcinoma.
Good morning to all. I, Dr. Subhangi Sahu, shall be presenting a rare case report on orbital apex syndrome secondary to nasopharyngeal carcinoma. The case is of a 44-year-old female who complained of pain in the right eye, which was associated with blurring of vision and dryness since 4 months, for which she had consulted a local ophthalmologist. She was prescribed glasses and topical lubricants, but it was not of much use. This was followed by complaints of nasal bleeding for the past 2 months. This was associated with fever and headache. She was on antihypertensives. On CNS examination, there were multiple cranial nerve palsies, and on ENT examination, there was left TNS with nasal polypoid mass in the right nostril. On ocular examination, the best corrected visual acuity was counting fingers close to face and near vision was less than N36. Color vision contrast sensitivity was not available for the right eye. Lid and adnexa had mild to moderate ptosis and mild proptosis. Schirmer's 1 test revealed mild dry eye. The right eye also had intact corneal sensations. Pupils were having grade 2 RAPD. Fundus had a temporal pallor of disc and retina was on. Left eye was essentially within normal limits. On strabismus workup, this is the standard 9-gaze picture. There was no abnormal head posture or DVD. On modified Krimsky test, there was 25 prism diopters of right exotropia with 4 prism diopters of right hypertropia and -1 abduction and depression limitation. On MRI brain and orbit with contrast, there was a large ill-defined heterogeneously enhancing solid mass with central areas of necrosis and hemorrhage involving the right nasal cavity. This lesion was abutting the right medial rectus, inferior rectus and superior oblique with narrowing of the right optic canal and involving of the orbital apex. This was suggestive of right orbital apex syndrome. The MRI brain with contrast and CT angio of brain and neck was also done, which was within normal limits. On careful workup of nasal endoscopy with polypectomy and biopsy and histopathology of resected specimen, the diagnosis came to be nasopharyngeal carcinoma, so which brought us to the final diagnosis of right eye orbital apex syndrome secondary to nasopharyngeal carcinoma with mild dry eyes. This case was then managed with topical lubricants and radiotherapy. Now, coming to review of literature, nasopharyngeal carcinoma is a tumor arising from epithelial cells that cover the surface of the nasopharynx. It most commonly presents as cervical lymphadenopathy with bone erosion. Intracranial extension can present with visual impairment. It is particularly uncommon in India. However, it is a highly radiosensitive lesion. Therefore, the best modality of treatment is radiotherapy. So to summarize, orbital apex syndrome is characterized by vision loss, ophthalmoplegia, ptosis, and may or may not be associated with hyposthesia and reduced corneal sensations. And it can have varied etiologies such as inflammation and infection, etc. So the take-home message from my presentation is that nasopharyngeal carcinoma is one of the most easily misdiagnosed tumors as it doesn't present with nasal symptoms initially. The initial presentation will depend on the tumor location and extension. A careful clinical workup and relevant lab diagnosis is the crux to establish the correct diagnosis. Till date, very few literature reports are available with nasopharyngeal carcinoma presenting as orbital apex syndrome. The visual prognosis in these cases depends upon the visual acuity at presentation and extent of involvement of the optic nerve. Thank you all.
Very nice case. Was there any improvement in vision after radiotherapy?
Yes, sir. There was not fully recovered, but there was some amount of improvement.
You must quantify that some amount of improvement, no?
Yes. Yes, sir.
So you can tell us how much the visual improvement was in terms of Snellen or ETDRS charting?
So from CFCF it came to around 636 and near
good.
vision also around N18 it came around.
Very nicely presented, and just avoid using short forms when you're making a presentation.
Sure.
Rest everything was very nicely done. Thank you, Dr. Sahu.
Thank you, sir.